that's why I do this, because at the end of the day, like somebody says, like, the richest place in the world is a graveyard. Like I'm going to die eventually. The biggest thing that I need to make sure I'm doing is making the impact on people. And that's the most important thing.
Hello, everyone, and welcome back to another episode of the PTA Plus podcast. I'm Katie Sutton, your host. Today's guest is Briana Drapp. Briana is the owner of PTA Elevation. This is a company that she started on her own in order to help PTA students prepare themselves for the NPTE. Briana has since moved herself from a PTA and transitioned into a DPT, so she talks a little bit about that journey as well. Now, if you are a student who's getting ready to take this exam in July or October, or if you're an educator and sometimes you just don't know exactly what direction to point students in, this is an episode for you. She talks a little bit about the pitfalls of studying and how we get ourselves caught into some of these traps. She has a lot of great tips and resources and really helps students prepare themselves emotionally, mentally, and physically as they get ready to take that big test through her programs in PTA Elevation. So again, don't miss it. We want you to join this episode so you too can be ready to take that big NPTE coming up here real soon. Thanks for listening. Hello, everyone, and welcome back to another episode of the PTA Plus podcast. I'm Katie Sutton, your host. Today we have Briana Drapp. Am I saying your last name correct? Perfect. Yep. Wonderful. Well, welcome to the show. I'm super excited to have you on. You and I have actually been messaging each other back and forth for quite some time now, but you had some big things happening in your life. So we kind of had to push our time limits a little bit. And of course, my recording windows are a little bit awkward with me being in education as well. So we found a time, we made it happen. I'm, like I said, super excited to have you on to the show. You are a great example of the type of person that I love to have on the podcast because there's several things that you've accomplished lately that I think are really important for this audience to hear. Mostly our audience is PTAs, of course, as in the name PTA Plus. But you're a perfect guest because you're a PTA turned DPT just recently. Congrats, by the way.
Thank you.
Really cool. You chose to move forward in your education, which I think that we have a lot of like-minded individuals that listen to this show that are often thinking about the next step in their career. And maybe that looks like DPT for some people. Maybe it doesn't. And I think that you can offer advice on both ends of that spectrum, of course. Then you started your own kind of niche business. Like this is some unique things that you're doing. You are the owner of PTA Elevation, correct?
Correct. Yep.
Yeah. And I mean, it's unique in and of itself, and we're going to dive into that. A lot of our listeners do like to be very creative with their skills. Again, the whole premise, PTA Plus, we're a physical therapist assistant, but we have all of these other things that make us a human and that expand us beyond just what our degree tells us that we are. So I am excited for us to kind of dive into all of those details. But before we get started, would you mind just telling everybody a little bit about who you are and what you do?
Yeah, so my name is Briana Drapp. I started a business called PTA Elevation back in 2021, which helps physical therapist assistant students study for their licensure exam. So I'm sure there's probably some students here who are like, hey, I listened to her yap for a while. So like, I know who this is. So thank you for your support to all of you listening. But I started that business because when I came out of school, there was nothing. There was literally nothing out there for PTAs. It was all PT related. And actually, the first thing I found was the PT Pintcast. That was the first thing I found that had like NPTE stuff. And I listened to every single episode. I was like highlighting in my books and like I was taking my practice exams. I was saying, what are the things that these NPTE people who are teaching are like showing up on the exam? And I'm like, okay, I see there's like these correlations, like keywords and stuff like that. I'm just like, wow, like this all makes sense. So I felt like I kind of like cracked the code as I was studying. And granted, I had a lot of time to do this because this was in the height of COVID, so that was fun. So I ended up going through all of that, and I passed my boards in January 2021. And then my PTA boards. And then I helped my boyfriend study for his boards because he didn't pass on his first attempt when he ended up taking April. We actually graduated together. So that's cute. So, yes. And
that is adorable.
Yeah, he was just like, he literally was just like, Brie knows what she's doing and I want to pass. And that's how we started talking. But when it came to helping him study, I still was noticing like the same things are popping up on these tests. Like he was taking different tests than me. I'm like, these same like topics are showing up. I'm like, there is a code here. So once he passed in July, around like literally like August, I started PTA Elevation and like fully launched it in September of 2021. And I started making podcast episodes, videos, and all this stuff to help students study for their, licensure exams, because I basically created the thing that I wish that I had when I came out of school. Because the podcasts and stuff I was listening to, super, super helpful for me, but there was so much stuff that was like above what a PTA would need to know. And I always kind of tell students like, hey, there's a thing like if you judge a fish by its ability to climb a tree, it'll live its whole life thinking it's stupid. Like that's how I felt when I was like listening to all these, like, which outcome measures to select, which special tests to utilize, like how would we do discharge planning for this patient, just all this stuff that's like not in the PTA scope of practice that wouldn't be on the test, but it kept showing up on all of these like study materials. I'm like, we don't need that. So I basically created something that was truncated and got straight to the point. Like I think my episodes are like usually around 15 minutes, if even more, about like a topic. I'm like, let me just tell you what you need to know. And so that's what I created. It was working really, really well. I started taking on clients like officially around like, October leading up to the January 2022 exam. And so from that point forward, we just kind of kept rolling. And during this whole time of me like studying and whatnot, and like me doing all this with the prepping for PT Elevation, I was taking classes to get me into physical therapy school. So yeah, so during that time, I took some of my prereqs. By the way, if you have a child that wants to take AP classes, please discourage them. They don't transfer to PT school. It doesn't matter if you get a 5 on the AP bio test, you're still going to be sitting there after you've already graduated with 2 degrees, taking a bio class at a community college because it didn't count. Do dual enrollment. That's my 2 cents on that. That's something I get really fired up about. Like,
drop us some advice here. Love it.
Like, don't do it. Just get good grades, be well-rounded, get into college. It's fine. But I was doing all that, so I finished all my prereqs, and then I was still, doing everything PTA Elevation. I was actually working 40 hours in a clinic, PRN as a PTA, and outpatient orthopedics, which I love outpatient ortho. I know there's some people who are just like, that's my worst nightmare. I love it out here. I have a great time. And I really genuinely enjoy being a therapist and working. So I just wanted to learn more. So that's kind of why I went back to PT school, basically because I'm a nerd. Like when people ask, why'd you do it? I'm like, I'm a nerd. Like the autonomy part and like the more responsibility, I'm actually kind of like about. That's why I like to work PRN, so I'm less like in charge of the plan of care and stuff. But I genuinely just wanted to learn more things and kind of learn like the true difference between what is PTA, what is PT, because then that helps me with my business too. And so that's why I ended up starting working with PTA Elevation. I did it all the way through school. So I was doing PTA Elevation, working, about 48 hours in the clinic and doing PT school all at the same time. It helps if you're in a hybrid program. I love hybrid programs. I think they're the best option for anybody because you can actually like make like a flexible schedule. With that being said, you have to show up to your classes. So I was doing all of that. And then, PTA Elevation kept growing, growing, growing. So it's been a very successful business. I've helped like almost like 2,000 PTAs pass their exam. So that's really exciting, just being able to make that much of an impact. I mean, I have students come into the clinic who are working under different PTAs and PTs, and they're like, oh my gosh, I listened to you. Like I had one student, like they like came in, I came in to cover, I was just typing on my computer, and like I hadn't said anything yet to anybody because like I just was like logging in and whatnot, and I like turned over to them and I was just like, hey, can you tell me a little bit about so and so? And they look at me, they're like, I know you. I'm like, oh, hello, hi. Like I try not to be like
you do
incognito mode out in the clinic, but like I know I have an impact, and I definitely like appreciate when people come up to me. Like they'll come up to me, I feel like I'm almost like a celebrity. Like, gosh, I know you. I'm just like, hi. How have I been able to help you? Like, are you a PT student, PTA? Because even PT students come up to me and ask for help because my stuff is like so intervention focused that they find it helpful. So I was able to finish PT school. I graduated December 2024, and I passed my exam in January of 2025. So I've been working out in the clinic, and that's why Katie and I couldn't meet and for a little bit. So we had like a lot
you were
going
busy.
but now we're good. Yeah. So I work twice a week in the clinic. I'm covering someone's maternity leave, which is like super nice for like scheduling and stuff like that. So I'm just working 2 days a week in the clinic, working on PTA elevation. My boyfriend and I do a lot of like Spartan races and stuff like that. So we're trying to stay active. We do a lot of skiing. Like we're really just trying to be living our best lives with our 2 cats in our house. Like that's really where I'm at. So that's just a little of the snippet of the backstory about my journey and why I went back to PT school and stuff like that. I don't think it's for everybody. And that's why I tell people, like, if you just want to go back to PT school just for the status of being doctor, I don't think that that's enough. If you think that you're going to make more money, the debt from it is insane. So find a way to balance it. Like I was able to pay for like at least 2 semesters cash out of pocket for PT school. So I was able to knock down my loans too and paying them down. I think I have like maybe 38K left in loans, which is pretty good graduating from multiple programs, like with
Yeah,
only that much. So like have a plan. And it's
that's
definitely like I have no regrets. I think it was good. I have some regrets about some things that I did during school, but we're gonna plead the fifth on that one. But when it comes to the journey for myself, it made sense for me. Like I was like, if I'm sitting on my deathbed, would I have had regrets not going back? And I definitely would have. So I'm very happy where I'm at right now because, like, life passes anyway. So if you go into it with a plan and realize like you are going to have more responsibility, you are going to be doing more stuff. Um, but understanding if you truly want to be the person who's in charge of the plan of care, has that autonomy and, all the responsibilities of the DPT, go for it. If you're like, I'm really happy treating patients and just vibing, awesome. Then either if you go DPT, stay PRN, or just vibe it out as a PTA. Because like I think I forget sometimes that I'm a DPT when I go in because I'm like, oh, blah, 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 just hanging out with the patients. And then they're like, here's an eval. I'm like, oh, yeah. Or
yeah.
like somebody sends
That's
me a
me.
note and I'm like, oh, yeah, I have to co-sign this. Like, oh, I forgot about that. Like that kind of part. Like I was in the clinic and I was supervising like a student and, they're like asking me questions and blah, blah, blah. And then they're asking about like their discharge planning. I'm like, oh yeah, this is me now. So I feel like, but I don't forget my roots. So like I try to do things that make the PTA's life easier, like, creating templates ahead of time, like setting up a good plan, having everybody on the same page, really introducing this patient to the other PTA and stuff like that, and really viewing them as a teammate versus like any sort of like I hated when they were just like, oh, this is my assistant. I'm like, I'm your teammate. Like we're in this together. Like you're
We're
making it
partners.
seem like I'm like it's not what it is. So that's just the biggest thing. So I don't forget my roots. Like when I was with tech, I didn't forget about that when I became a PTA.
Mhm.
Like I worked front desk and stuff like that. Like I worked everything in the clinic. So I really just try to be all encompassing and helpful. So that's my advice about if somebody's thinking of going back. I know I was yapping a
Mhm.
lot there, but hopefully that answers some of the
No, that's
questions
a
that people might have been thinking about that you thought. But
yeah, great
yeah,
introduction.
I'm happy with where I am right now.
Yeah, and that's the whole point, right? Like you have
Yes.
to be happy and comfortable with what you end up doing in the end. And that's exactly what you said is you thought about would I have regrets if I didn't do this? And it sounds like for you the answer was yes. Now that's not going to obviously be the same for everybody else. I mean, I'm 20 years into my career, but which by the way, 20 years ago, there really was nothing out there to study. I mean, I think I bought some kind of a book to study online that was like it was like thin like that. And of course, now most study books, as you know, are big honking books and stuff out there. So, pretty, yep, yeah. Look how big that is. Yeah, compared
I
to
do
most.
find the score
And
builders text to be very helpful. I'm not affiliated with them at all, but I do find it to be helpful. People like the therapy ed as well. I tell students, so now that you mentioned that, it made me think of something. Because I know
yeah,
we're going to talk about like exam advice too. Making sure that students don't look at their school notes. And it's not because you did a bad job as a professor,
mhm.
it's just different. It's
It's
almost like a
good
different
advice.
dialect kind of thing, where it's like, it's not like
Yeah.
if you say one thing to somebody, it's not exactly the same as what the boards is asking. It
Mhm.
teaches you for clinical practice. And like, that's where I got in trouble because it was like, oh yeah, no, they're not going to be helpful for you when you're studying for the boards. People kind of sometimes, especially professors, take offense to that. They're just like, well, I'm teaching things that are helpful. I'm like, yes, you are doing great for clinical practice. There is a difference. Like even if you're talking about like the phosphocreatine system, like on one, your school notes might say it's 10 seconds. The board says it's 15. Like that could make a difference in somebody getting the answer incorrect or correct. And it's not like it's wrong. It's just like, okay, short bursts of energy. Cool.
Mhm.
Awesome. That's really all you need to know for clinical practice. But examples like that. So I'm like, just get a book, make it work,
Mhm.
study that. Less is more. Don't have too many cooks in the kitchen, people telling you all different ways. And I feel like this is something that's really good for all different types of life. If you're trying to grab mentor after person after thing, like everybody telling you things, books,
Oh yeah,
books,
you're
hard
going to
news,
get 1,000 different.
you're just gonna you're not gonna get anywhere. You're just doing this thing. They call it a circle. I read a book, I think it was like first first line leadership or something like that. It's green,
Hmm.
but he talks about like circle world where people are
Okay.
just circling and circling and they're never moving forward. I'm like, just pick something, stick to it, and move forward. Like, too many cooks in the kitchen. Like, everybody's gonna cook you a good meal. They're not all gonna cook you a good meal together. Pick one thing, find what works, gun to your head, pick three things, move forward. And I think that applies for a lot of things, especially like mentorship or like what people are telling you. Nobody's like wrong, but nobody's like you gotta find what's right for you, if that
Mhm.
makes sense.
Yes. I always tell people, I say, and I kind of may have taken this from some kind of a meme that was out there at some point in time, but make a decision and stick with it because the life of road is paved with squirrels who couldn't make a decision. So make your decision and stick with it and just be committed to it. It's going to take work. I mean, you of all people know this. It's not like it's an overnight thing. It's not like you start studying and then the next day, all of a sudden, you're like an expert in NPTE. This
Mhm.
takes time, but be consistent with what you choose to do.
100. And I think it was I forget where I got this from. It was like layer brick every day and eventually you'll have a wall, but like every day it feels like you haven't done anything. But if you take a step back, you're like, oh, look how much I know I've
Look at
accomplished
what
with
I
it.
did. Yeah.
And that's true for anything. And probably need to follow this advice a little bit better myself sometimes, but we can't, you know, it takes a while. It's hard to look at
Yeah.
things from like a far distance out when you're
Oh
like
yeah. Yeah. Especially when
instantly
you're
to
in the
know
thick of
that
it.
something's going good.
Yeah. When you're in the thick of it, you're just looking at that one thing that's directly in front of you and you're just going to kind of
Hmm.
be slightly obsessed with that and not be able to see the full picture. So now I can understand that. What are we, I mean, because you kind of touch base on some things that you've actually touched base on a lot of things that I want to talk to you about, but
Oh, perfect.
what are we getting wrong with PTAs or student PTAs studying for the NPTE? So, what
Oh,
are we
biggest
getting
mistakes.
wrong? And then what are we getting right?
Oh yeah. So I think one thing that people are getting wrong, I kind of touched on it earlier, is you're studying for the PT exam instead of the PTA because you're getting the wrong information or you're trying to overstudy. Really, and it's really hard to kind of determine it unless you like have like a resource like me. There is another person out there that just does PTAs, but I don't want to promote them because they're not a nice person. But just finding someone that just does like PTA stuff is going to be helpful for you, or at least I tell people like there's great resource out there. Like Final Frontier has good stuff. Kyle Rice and the PT Hustle, it's a good friend of mine. Like they have great stuff over there. But you have to, I tell it, like putting on your PTA filter glasses and being like, hey, like, that discharge planning, that's not really our scope. The selecting outcome measure, not really our scope. And like really trying to determine, like listening to what they're saying and just pulling out the PTA stuff instead of just feeling like, okay, everything this person's telling me is the Bible. Like, let me just listen to everything they say, take it a step back. I think we kind of talked about too many cooks in the kitchen, trying to pull from too many different places. I tell people, I'm like, list your top 5 NPT study resources, and one of them has to be the PEEPs. So that's non-negotiable. Take your PEEPs, take practice exams. That's another thing people get wrong, is that they're like, oh, I'm not going to take practice exams until like 2 weeks before. I have educators tell me that they make their students take like 2 PEEPs the week before they take the test to work on ramping them up. I'm like, they don't have time to review those. They don't have time to make, strides in understanding. You're burning them out. You're doing like 2 15-mile runs right before you do the
Mm.
marathon. Like, that makes no sense. Like, come on, like, even think of this training wise. Like,
Yeah,
makes no
that's good
sense. That's
advice.
why, like, yeah,
Mhm.
I tell students, like, don't take your test until don't take your last test at least a week before, if not like within the last 2.5 weeks, just to make
Mm.
sure you have
Okay.
time to review that, know your mistakes, review your weak areas and stuff, and know that you're not going to know everything. You're going to show up on exam day and there's going to be stuff on there that you're like, I don't know what the hell this is. Like, what is that? I had something, it was, I think it was on a practice test because there's always stuff that pops up and I'm like, I don't know what that is. And like, I teach this and I've been doing this for like 5 years at this point, like at least like studying, learning information, preparing people for this, including myself. There's stuff that pops up. I'm like, what is that? Like, I'm like, it was the cremasteric reflex or something like that. It's like a
Mm.
scrotal reflex. It's like to assess like sacral nerve root
Okay.
integrity. But like I was like taking this test and I saw it pop up. I'm like, I don't know what that is. Like I'm like, maybe it's on the leg. Like I don't know. But like if you're a pelvic floor person, you're like, oh yeah, I know that all day long. Like you're
Yeah.
good. Or neuro too. And I'm like, I don't know. And there will be stuff that pops up that you don't know. So don't feel stupid when you don't know it. Do the best you can. Honestly, just pick something and move on. Like don't be boggled down by that question because it might not even count anyways. I think that was one of the ones that was actually thrown out. So it didn't even matter anyways. So
Hmm.
that's another thing. Like there's, oh my gosh, I could go on all day, Katie, about all the mistakes that people are making. But I'd say the top three in my thing is just like doing too much planning, grabbing too many people, using too many resources, overwhelming yourself and getting nothing done. Just like get started. Just take a practice exam. That's the first thing you do for your studying. Take a practice exam, see where you're at with everything. It'll give you stuff to study from. You can kind of go from there. And now you're in a flow of reviewing and studying for a couple of days. Now you're in it. You're doing good. You've started. Other thing is not taking enough practice exams. I usually tell students take between 4 and 5.
Okay.
That's a good amount.
That's a
Um,
good piece
and
of
then
advice.
waiting till the last second. That's another one. So right now, as we're doing this, it's May 19th. The July exam is coming up. That's
Hmm.
less than 8 weeks away. I actually start closing up my courses and deterring people from joining because I feel like they won't have enough time to adequately review everything.
Yeah.
Now, if you're listening to this at this point, you're just like, it's like 7 weeks before my test, and like I haven't started yet. Like just get started. Don't worry. You don't have to. This should not be an indication to just like immediately combust and cry. But like, be realistic with yourselves. You're trying to pack in like for PTA programs, anywhere from a year to 2 years worth of information, depending if you're doing accelerated or if you've taken classes previously or whatever, of information. You can't learn that in like 6 weeks. Like I think a lot of people like graduate this weekend and they're like, oh, now I'll start studying. It's like, okay, it's here, it's coming. So
Mhm.
that's a big
Yeah.
mistake students make. And I think a lot of times educators kind of encourage students to take the exam right after they graduate and they're not ready. And I think educators should stand a little bit more firm on saying, like, hey, you're not ready to take this. Because I've seen at my school, there was a bunch of students who failed the P. They said, hey, you're not ready to take this in, you know, January. You need to we're going to approve you for April, but not for January. And these students pushed back so hard and they had their parents even call. And I will call people out on just like how absurd that is in the doctoral program. Your parents are calling to say like, oh no, we need to take this right now. Like, no, get a temp license if you really need to work. Like, go get a temp license and call it a day. Like, if you really need to work. But if someone's telling you you're not ready, you're probably not ready. Like, and if you're not sure if you're not ready, message one of these like board prep people and say, this is what I'm getting. Am I ready? And if we're telling you no, you're not ready, we actually see people. This is what we do all day long. If we're telling you you're not ready, you're not ready. And I tell people you're not ready yet, not that you're
Oh
never
yeah,
ready.
yeah,
And
definitely.
that's what I tell people. And some people, because some people get in their head, they're like, oh my gosh, I'm stupid. I'm never going to pass this. Like, I'm like, no. I'm like, you will be ready the next time. Give yourself adequate time. Be realistic with yourselves. We talk about SMART goals all the time for our patients. Let's set those
Right.
for ourselves. The R and that stands for realistic. So, I mean, and I do not take the NPTE as a, oh, let me see where I'm at. There was that connotation with the SAT. Oh, let me just take it and see where I'm at. No, don't do that with the boards. Like some states, like Oklahoma, you only get 3 chances to take it there. Florida, if you
Yeah.
fail 5 attempts in Florida, you can never practice in Florida.
Wow.
Like
Wow.
you can never practice in Florida. So I'm like, don't do that. Take your PED exams. It's a lot less low risk, a lot less money. So I mean, I could go on all day, Katie. I got a lot of things that I feel like people
No,
mess
I think
up
this is
with.
great, and I'm very happy to report that
Yes.
I have corrected most of these things over my last 15 years of being in PTA education because I don't think that I mean nobody teaches us how to teach the student how to study
Exactly.
for that. You know, a lot of this is just us digging in as educators trying to figure out what's going on, and of course
Yes.
we. From any school, I would assume I am kind of making a very broad brush statement here don't necessarily promote one specific tool over another or whatever, you know. In my case, I usually give students a plethora of options. And I'm like,
Yes.
there are many tools that you can use. But again, going back to the consistency thing, something that I also say, and maybe I don't know, you're probably much more of an expert at this than I am, seeing how many people that you've mentored though, is I say when you come back from the clinic, you can't necessarily put your clinic perspective on those practice exams.
Oh my gosh, that's another
You
thing,
you
Katie. The
need
clinic
to
is
be
not
paying
studying.
attention to what's in the textbooks that you're using because most NPTE questions are sourced from a handful of textbooks. They're not going out and necessarily pulling these questions from clinicians. So you go out, and if you take your practice exams with your clinician hat on, you're probably going to get some of those wrong because you're thinking like a clinician, not like a foundational information, research-based kind of fact-based type information. And maybe I'm wrong. Am I wrong?
No, you're 100% on the money. I tell students the clinic is not studying. And they're like, but I'm like learning stuff. Like the clinic is great for you becoming a clinician. The clinic is great for reminding you like this is why you want to do it. I think so a lot of people when they're in the thick of studying, they're like, oh my gosh, like I don't want to do it. Like when I go to the clinic and I'm like helping patients and I'm seeing them get better and I'm interacting with them and just like seeing how movement is medicine, like that helps keep me on track with like grounded with like this is why I'm doing this. Like you didn't go to PTA school to take a test. You went to PTA school to become a PTA and treat people. So the clinic is great for, I think, the morale boosting and the,
Absolutely.
stimulus of just like, this is real. Like I'm studying for something that's going to be real. But I tell
Yeah,
people
give
when
you
you go to
something that you're wanting to work towards. Because I mean, yeah,
100%.
the NPT is big. This is a huge part. You can't practice without it, but you still gotta like what you do at the end of the day.
100%. And that's why I tell students when you sit down to study, you have your two boxes. You have your clinic box and your board studying box. You cannot mix the boxes. Some things do go in both boxes, but you need to have the clinic box closed when you're studying for your boards. If you find yourself answering a question and it's like, okay, like, well, I saw my CI do this and that probably worked. It was probably helpful. It's not what the boards want. I personally, I work at a foot clinic. I do not do ankle four ways with people. I saw it was in a chart somewhere where I covered recently. I was like, oh, forgot about these, that this was a thing because I'm so used to other things. Like we focus on balance and great toe and stuff like that. That's where we're at. We're drinking the Kool-Aids on that, but my patients are better. So I'm like, it's fine. The boards would not be liking that. The boards would be like, do the strengthening of the ankle. Start with the four ways before you do balance. Like the boards thinks it's that way. If I was trying to think of how I'd modify an orthotic in real life versus what the boards wants, the boards is like weird ass orthotics. I'm like, this is not real anymore. I did tell
Very
students the same thing.
straightforward
I'm
information.
like, this is weird. Like,
Try
I've
not
never
to veer.
yeah, I'm like, I don't know how I feel about this, but that's what they want. So you have to separate yourself. You have to, it's almost like the Severance show. You have to like literally separate yourself, even though some things overlap. But that is a big mistake. That's probably one of the top three. I would say that I don't know. I
Interesting.
have a lot of top threes, but that's the big mistake people make is using the clinic stuff. And I'm like, it's not wrong because then people get offended. They're like, oh, you're saying I'm teaching the students wrong. I'm like, no, I'm saying this is not what the boards want. It's
Mhm.
just
Yeah.
different. It's not wrong. It's just different. Like,
Yeah.
can we like British people call what we call fries chips? Like, it's not bad. It's just different. And yeah, I think a lot of educators, I think just need to get off their own horse and get off their high horse, humble themselves down and be just like, I'm not the greatest thing that's graced the physical therapy world when I'm teaching students. Like I have to understand, I have to teach what the book wants. I can give them my own advice and mentorship in the clinical side, but I can't be teaching basically the Bible of NPT studying based off of my own experience because that gets really all over the place. So that's a
Interesting.
mistake I see educators make. I'm like, just teach what the boards want. You're not a dummy. You're not wrong. It's just different.
Yeah.
So that's
Yeah.
I
Yeah.
could go on all day about that though.
Well, I mean, it's an interesting path to walk
Yeah.
because you do hear from the educator perspective, from the clinical, uh, from your clinical faculty that students need X, Y, and Z. Well, then you have to balance that with what's happening in the academic realm, and it's kind of like this blend and mesh of what the students need. So they're all challenging roads to walk, and making sure that we get the students what they need in a very short period of time. I mean, in the state of Ohio, we have to be under 65 credit hours, and that means that we have to have everything in there and meet the exact same standards as every other PTA program in the United States of America, even if they have way more credit hours than we do. So that can be a bit of a challenge, but anyways, I digress. So, more about PTA elevation. When somebody is going to come, and we're going to put all of your information in the show notes so people
Oh yeah,
can
no
find your
problem.
links and all of that good stuff. But if someone comes to you and is like, hey, I want to work with you, what can they expect from your tools?
Oh yeah, so I mean, I got a lot of stuff. I have two different programs that I use with students. I have what's called my 600 plus system, which is I don't want to say it's independent study because it's not. You still have access to it and everything, but I have a coaching program as well. So I'll kind of talk about the extra things with coaching. With the coaching program, those are students who need a lot of accountability and help. You're like, Brie, I just want someone to teach me the right things and not get lost and just have you there if I need help. Perfect. 600 plus system will cover all those bases. But I have a lot of students come to me who like, they've taken the exam multiple times. Like I'd say the average amount of attempts a student comes to me with, because my stuff is expensive, so they wait till like they're like, oh my god, I need to get over this hump. I'm over this now. It's probably on their third attempt is by the time students like come to me for
Okay.
help.
Mm-hmm.
So I have students coming to me, and they struggle with the accountability at this point because they're so beaten down by everything. Their parents don't understand, their friends and family don't understand who
Mm-hmm.
didn't go through school and stuff like that. So they just really need a good community and a person to lean on. So I kind of provide that for them, talking through, other mental blocks that they might have. Obviously, if it's to the point where I'm like, hey, you need a mental health therapist, I will straight up be like, hey, you need a mental health therapist. I see a therapist. Like it's not a bad thing or anything. I think we're at the
Absolutely.
point now in
Yeah. Mm-hmm.
2025 that it's just like it's weird if you're don't have a therapist, honestly. If you be able to,
You should
if you
try
have
one. Yeah.
insurance, like it's weird if you don't have a therapist,
We should
especially
do
for
a check-in just like we do everything else, right?
exactly. And
Mhm.
so I'm like, listen, I go to the gym for my body, I go to therapy for my brain. That's all it is. So when it comes to with students, I really just try to give them a lot of resources. I give them practice exams. We do extra study sessions. Listen, the people love Kahoot. If they're an educator, the best thing I can say is just play Kahoot with your students. They are competitive. They love it, and the
Yeah.
lobby music, like they perk up. Like it's a wonderful thing. Just like never stop playing Kahoot. The people love it. But with that being said, I just offer them a bunch of different, other practice things that they can use, such as quizzes. I have a whole resource library full of videos. It's probably like almost 400 videos at this point. I haven't counted in a while, but I tell students like, hey, you can kind of use this how you would use like a library. Like you need extra help with something, go grab something, look something up. It kind of helps them walk through the material either in their score builders book, therapy ed. It can work with both. We've got like the pathologies to the basics and stuff. I think a lot of people think, oh, the exam's all pathologies. No, do you know how the gait cycle works? Like, do you know where the heart is in the body? It's actually on the left side. Like, there are things like that. Like, so it's really funny because you forget these things because you're
Yeah.
like,
I mean, it's a
oh,
fire hose
that's
of
so
information, right?
basic. Like, how did
Mhm.
I forget that? Because they'll be like, wait, why is the tricuspid valve on the left sternal border? I'm like, if it's the right side of the heart, I'm like, well, your heart sits to the left. And they're like, oh my God, how did I forget just something so basic? So I think going back and just making sure those foundations are good, because if you don't understand the foundations, it's going to be hard for you to understand the pathologies and stuff like that. And it's no shame going back if you feel like you're like, I forgot the pathway of blood through the heart. That's okay. Let's look through it. So then that's going
Mhm.
to make a lot more sense when we get to something like congestive heart failure. So
Mhm.
that's the biggest things that I offer for the students who are in coaching. Offer them those one-on-one calls with me, extra check-ins, and we have a nice community of people who are all very supportive. I really just try to keep good vibes. Like we share cat pictures and dog pictures in there. Like we're really just trying to keep everybody positive. So the biggest thing that I tell for students is that they get when they come to me for help, regardless of which program they're in, they're going to get a community, which is what a lot of people look for, especially if they're on their third attempt. Like all their friends have passed, they're working, like people are getting married and having kids like after they've graduated because they're like, okay, I can start my life now. And they're just like, man, I feel like I'll be behind forever, and like my life is, I'm like stuck here, and like I can't get out. Like having a community of other people who are like in the same situation makes me feel a lot
Mhm.
less alone. And I like honestly, when students ask me questions, like nobody's submitting stuff anonymously because I've created such a safe community that everyone feels comfortable asking questions. And I try to say like, I mean, you're being a weirdo and an asshole. Like first of all, get out of here. Like I'll kick you out. Like I don't like
You're
no, I
not
don't
going to take
tolerate
any of that.
like no, this is not allowed in here. We're all going to be positive. We're going to kumbaya, and we're going to be happy in here. Like that is what we are
Yeah.
doing. So the community is a great aspect. They'll get access to me, so my guidance, teaching them how to make study plans, different study strategies, test taking strategies. I mean, I have students come to me and they just didn't know how to study because studying for the boards is different than studying for school. I
Yep.
made flashcards all day long. I was reading and highlighting all day long for school. I was rewriting out all of my notes and everything all day long for school. that worked. If I tried to do that on the exam, I would make flashcards for like half of musculoskeletal within 8 weeks, and that's it. Like, and I never even look at them. Like that's just how it would be. So,
I'm
it's just
embarrassed by the amount of highlighting that I did when I was in school. I mean,
oh
this
yeah.
was a long time ago. We have truly advanced past that, but it's quite embarrassing if I would have looked back on my old text,
Oh,
which I
I
have
highlight a
since
whole entire
recycled.
page and then be like, wait, what's actually important?
I know, like it just
It's like,
the whole thing.
I went through so many highlighters, and now I have them all just sitting there because like I don't highlight anymore because it's like,
Mm,
okay,
mhm.
we're already there. But
It's a tool. It's not the only tool. Yeah.
yes,
Mhm.
underlining is a nice tool as well. I realize that that's also something you can do. So like I'm like, if something's highlighted and underlined, that means I like saw it on a practice exam and I thought it was important and it was in another video. So this is probably very important.
Very
So I should
important. Yeah.
probably look at that. Like if it's talking like left-sided heart failure affects the lungs, like wow, that's something I've highlighted, underlined, and boxed and whatnot. Like that's probably important. So that's another thing students will get. It's just different study strategies and test taking
Yeah.
strategies, how to make a study plan and stuff like that. That other things people forget to talk about, like how can you stay motivated as you're studying? How can you avoid procrastination
Mhm.
when you're studying?
These are
Studying
all
is
important.
boring. And it's okay that it's boring. Some people think it has to be this exciting thing all the time. No, you can look at this and be like, I'm fucking do this right now. Like, I don't want to study the gait cycle. Like, I don't want to look at postural drainage. Like, I'm not going to be in a hospital doing this. Like, I don't care about the different types of like, tubes and lines. Like, I don't want to see another big line ever again in my life. Like, and that's fine. That's why I tell people, I'm like, I'm not only going in a hospital if like I'm dying. Like, I'm only going in a hospital. I had a 6-week ICU rotation. I have never felt more out of water. And this was in PT school. So I'd already been in PTA for a while. I had never felt more out of water and more like what is going on than being there. Although the internal medicine doctors and the OTs and everything, like the people I was working with, great, super
Oh yeah. Yeah.
helpful.
Mhm.
Everything going on though, I was like, I don't know what's happening.
You
I
can
don't
work
know
with
what's going
amazing
on.
people and still not want to work in that setting, and that's
Yeah, so I was
okay.
like, I'm happy for what you guys do. You'll never catch me here again.
Mhm.
Like,
And
if
that's what
I'm
makes
here,
them
I'm
really
done.
good at their job, right? Because
It
they
is.
love to do it. Yeah.
Exactly. And that's why I tell people like there's PT for like there's a PT setting for anybody out there. If you want to do physical therapy, there is a setting there for you. 100%. And you
Mhm.
can switch settings and you can switch jobs and you can jump laterally. It's fine. It's 2025. We're trying to get paid.
Yeah.
Quit your job and go to another company if you need
It's
to. Like
okay.
it's
Yeah.
fine. Everything's good. Just don't burn bridges. That's all you got to do. Um,
Absolutely. Mhm.
but another thing about working with me, so look at the guidance, look at the accountability of me being there. We have our weekly meetings, so students can come in and ask questions every week. You can send me messages and ask questions whenever you want. Like I just open it when I'm able to, because like right now I had 3 students send me messages while we're just doing this recording. Like I'll answer them when I'm able to. I had somebody send me a message at like 1 a.m. last night because they're in California.
Ooh,
Cool.
yeah.
Doesn't
Mhm.
matter. My phone's on do not disturb. Just send me
Mhm.
a message. I'll get to it when I'm able to. But
That's part of your
um,
package, huh?
yeah, I'm like, we'll get there. It's it's
Mhm.
it's, it's gonna be ready, but they'll have that, and then the resource library of all the videos and content and quizzes and exams that I have. All of those will help students. I also have a review session that I host every time before the exam happens, where
Mhm.
I do about 12 hours of content over the course of 2 days, like a
Wow.
Sunday, then another Sunday. The following Sunday, we'll do this. But we'll go over scenario questions. We'll play Kahoot again because the people love Kahoot. Like, if
Mhm.
anything you should learn from this meeting, it's play Kahoot. It is so fun. Like the people love it. So that's another thing. But yeah, really the biggest thing is they get the guidance, the accountability, the tools, and the resources to be successful. That's really what it is. And obviously, I can never guarantee like, oh yeah, use my resource and you're 100% gonna pass. Anybody making that guarantee is delusional because like I'm not in the test. I'm not taking the test for you.
Mhm.
Like
Yeah.
that's
Mhm.
illegal. Like I don't know I'm not going to know what's going on in the testing center, but what I can do is when students join my stuff is they'll feel a lot less anxious about the test itself
Mhm.
and it'll feel more possible. And I think just having that feeling really encourages a lot of students. That's for any student that uses any one of my resources. Obviously, my programs have all of my content that
Mhm.
I can share with them, but I have videos on YouTube. I have my podcasts and everything like that that help students out. I mean, I'll do lives, I'll like post like helpful things and whatnot. I'll do like my little quizzes sometimes on Instagram. Like I got all those resources. And I think just having a positive person, because like I love physical therapy and I love what I do. I think there's so many people out there in our profession that are like shit talking it. I'm like, I'm sorry you're not in the part of physical therapy that you want to be in. You can change
If you're
that.
getting bored with the information, if you're not meeting new people, if you're not discovering and asking questions, then you probably should question, am I in the right profession? Because the moment we stop learning, the moment we stop seeking new resources and network with people, I think that's where we kind of start to like fizzle out.
And you don't have to pay more money for that. I'm talking like listen to somebody's podcast or like, I don't know, go to somebody's like meeting somewhere or whatnot, or like Zoom session. Like you don't have to pay. They don't have to go back to PT school either. Like you don't have to pay all this stuff. Do you know how many exercises I've got off TikTok? Like I've got
Oh,
so many things. Like I'm
so
like,
many
this is
ideas
great.
and resources. And yeah, no, you're absolutely right.
And
So
you just
you
gotta be around positive people. Get off Reddit. People on Reddit are so so
I'm
freaking
not on Reddit, so
rude. I'm
I
like,
don't
what
know
am I
anything
about
about
to
that, but
say?
yeah, but that's interesting. Now you mentioned something that I think is really important, and I don't think that there's enough emphasis on this, is that your family and friends are probably not going to understand what you have to do to study for this exam.
No, they
And
want you to
I,
be happy, which sometimes they might be like, "Oh,
Mhm.
this is stressing you out. Maybe you shouldn't do it." Like that's not. They're not trying to be malicious, unless you have like a
Yeah,
toxic mother or something like that. Like
yeah, of course,
they're
yeah.
not trying to be malicious. They're just like, "Oh, maybe you should like study more," but like maybe you're studying too much, or you're overstudying, and you're not giving your brain time to like absorb the information. Like your family doesn't want you to be in distress. Like they're
No,
like
no, uh-uh,
they don't get it. And even if
no.
they like were a nurse or like had to take their law exam or something like that, they still might not get it because it's not the same test. Unless they've
Mhm.
taken the same test and they took it like within the last like 10 to 15 years, they don't get it. Like, and that's,
Mhm.
it's not the same thing. But I think having, family members, the biggest thing you can ask for family members is just when I say I can't hang out right now, I can't hang out right now. When I
Mhm.
say I need peace and quiet, I need to study, I need peace and quiet. When I say like, hey, can you like bring me, a sandwich so that I can keep studying in my room. Like
And then go away.
that's how they can be supportive. Giving weird unsolicited advice from like, well, my friend whose like son's like wife was a dentist and when she was studying for her DAT, it's like, dude, like no, I need NPT
I
stuff. Unless
know,
you're
it's
coming to me with the
so,
specific
yeah.
things, like the best thing I've seen some
Mhm.
people's parents do is just say, here's some money for Bree's course. I'm here to support you. I'll take you out
Do
and get
your
your
thing.
nails done once a week so we can relax or whatever.
Yeah.
Like that's what that's sometimes what you need. And I think just communicating those boundaries
Mhm.
again, as a white woman, it is different to communicate boundaries with my family that I've noticed for some of my students who are people of color trying to communicate with their families, especially those that are like very, very tight knit. It's hard and I understand that. But I think just like a lot of people need to realize when you say no to somebody else, you are saying yes to yourself. And I
Mm,
think people need to realize like you're
yeah,
not being rude, you're not being mean. It's more of a not right now, how about later kind of thing.
yeah.
So then you can give
Mhm.
yourself the time back. Like don't try to be everything for everybody. You need to give that time to yourself. Because it's very important. If you give yourself that time for, the 2 to 3 months of studying, perfect. You never have to do this again. The last thing you want is to try to spread yourself thin and be dealing with this a year and a half later, like some of the students I've been working with. So
Yeah.
it's kind
No,
of
speaking
a
of
whole
that, like
thing.
that's a perfect segue.
Yeah.
So you're essentially what I'm getting from your conversation about your study tools is that a lot of people come to you as a second and third attempt, but
Mhm.
that's not necessarily the case. They can use your tools from the beginning.
Oh
Um,
yeah, I have
but
students who like have 6 months left of their didactic left, and they're like,
yeah,
"Hey, you explain cardiopulmonary better than my professor. I'm gonna log in and use your stuff." Cool. That
right.
also works perfectly fine.
Good. So it's not necessarily meant to like replace anything else. It's
Yeah,
an adjunct
it's a
to
hundred
things. Like
percent
they can still
supplementary.
use their other study books that they might have, Score Builders, Therapy Ed,
100%.
Final Frontier that you mentioned. Like, and if we're not paid affiliates of any of these things, but they can use all of those or any of those in conjunction with the techniques and tools that you have.
Yeah, I have students who, are using my YouTube videos and they're also like in Final Frontier courses. I will say don't try to be in two courses at once because that kind of runs into the to
That
make
would
this
be,
in a
yeah, that would
kitchen
be
kind
rough.
of thing. I have seen people do that. I mean, I have students who are my course and Kyle's course at the same time. Sometimes like we'll both meet together, which then I feel weird because I'm just like, oh my gosh, hi Kyle, like I'm totally
Yeah.
catching up with him. But I've had students do that I think if you can handle it, that's okay, but that's a lot of money. I will say that is
Yeah,
a lot of money to be in multiple
yeah.
courses.
Mhm.
Things are gonna, conflict with each other. My stuff's all recorded, so like if you're doing a live thing with somebody else, like go do that. You can come to mine. You can watch mine on the replay. But my thing is best used in conjunction with like score builders or like therapy, or even whatever others textbooks you want to use that are like on the list of the P's, whatever the resources are. That's the biggest thing. It's just I tell students like this is something you want to add into your studying to help you. It's not going to, it can basically reteach you everything that you might have forgotten in school. That's completely valid. But if you're still in school and you want to use this, still remember you're studying for your professor's test. So it's not what would the boards do, it's what would your professor do, which sometimes are not the same thing. But that's the biggest thing is that I tell people it can be used in conjunction with other things. I tell students the PET is non-negotiable. If you are between buying my review session or buying a PET exam, please buy your 2 PET exams. Like that is the number one thing because that's going to help you the most. Obviously, I'm not affiliated with them. If I was affiliated with them, I feel like I wouldn't be able to do this because I feel like I'd be giving away quote unquote secrets. Like I wouldn't be able to do something like this. But
Mhm.
that's the biggest thing. And I think as an educator, what you can do to kind of help with that is reminding students they're going to be taking a licensure exam. The amount of students in my PT class who by the time we got to like our clinicals, they're like, oh yeah, so you're gonna have to take your licensure exam and stuff. And there were a couple students who didn't realize they had a licensure exam, which I think at this point,
Oh,
like that's
yikes.
concerning. But at the same time, I think it should be emphasized it's not like a cute little cumulative test you take at the end of school.
Yeah.
It
Yeah.
is like to make sure you are safe enough to
Mhm.
treat patients. It is to
Mhm.
make sure you can be a practitioner,
Yeah.
that you can be a provider for people. Like
Mhm.
people's well-being is in
Mhm.
your hands. And I think a lot of schools forget to mention this till it's a little later. They're like, oh, we don't want them to worry about it. My PTA school, first of all, my PTA school did great. Shout out to Central Penn College. I will shout them out all day long. They did a much better job than my PT school did with this. With I don't know if this is a little extreme, but the first day of PTA school, they gave us like 100 question mock board exam. We're like, here's what you're studying towards. And then at the end of our last semester, they had us take the same exam again. Granted, started
Oh,
seeing some questions, and I was like, oh,
that's interesting.
I
Yeah.
remember every question I ever take, which can help me and hurt me at the same time because then I could get a little confused. But I just remember taking the second time, I'm like, oh, these are easy now. Like, I got this. But
That's
at
kind of
the
an interesting
beginning,
thing,
I
huh?
got a 20% on this test. And they're just like, this is not scored, just it's for completion, but try your best on it. And like, there were so many things. I'm like, let me answer this. Like, okay, I saw my PT that I was shadowing under did this. Like, that was wrong. Like, I think
That's
emphasizing
really
there's
interesting.
going to be an exam at the end of all of this, doing that earlier rather than later, it
Mhm.
doesn't have to be scary. It's just
No.
saying like, hey, this is what we're preparing for. These are what the questions kind of look
Mhm.
like. Like, let's just make sure you know that this is what we're working towards. And seeing working towards the end goal was so helpful for me than just everybody getting thrown in being like, I don't even know what the exam will look like. Like
Mhm. Mhm.
we did the PT 365 questions every they had us download that and then at the end of the month we had to submit that we did all of them. Like that was the whole thing. And like I don't even think that we were submitting because we like would come to class and be like, so the question today, we want clarification on it. Like I think
Yeah.
that is helpful and I don't think you're scaring students. I think they need to be aware of what the end goal is. Like if you're doing marathon training, you're not just running around your neighborhood, you're going to be doing a race for, 3, 4, 5, 6,
Yeah.
in my case, probably 10 hours. I'm slow. But like you're gonna be out there for a while. So seeing what the end goal looks like helps people like it's not an abstract concept. It's like, okay, I know I'm going to be asked a question about this that has this weird wording that's like, what is the best option? And it gives me like 4 things that are all appropriate, but like only one is appropriate for this scenario. So
Yeah, and that's important. What you're saying for anybody listening who hasn't taken this yet, they're not trying to trick you.
they're
So
not, no,
as
they're trying
as
to
you've
test
already
you.
mentioned, this is to see if you are safe to be a licensed individual. There, it's not trickery. So
No.
keep that in mind. That they're looking for a specific safe reason.
100%. And I think this is what Jimmy was saying. They're not trying to trick you, to try and test you, right? Like I think he says that all the time. Like that I stays with me. And if you're like, oh, they're trying to trick you, trying to throw you out, no, your
Mhm.
professor might be. but the boards isn't. Like
Not
they're
me.
act-
I wouldn't do that.
no, I know some
I
professors
am
do.
not skilled at trickery, just so very, very clear here.
Oh no, I believe that 100%. But I mean, that's what it is. And the answer is right there. If you're making up a scenario in your head to make the answer you've selected correct, it's wrong. And that's where I tell students stop arguing these Pete questions. They have been literally like studied. Stop arguing them.
Stop arguing them.
Just accept it's the answer. The board doesn't care about your feelings. Like you can't argue your way out of this. You might have been able to argue your answer in school, and your professor's like, "Yeah, I could see that." Blah blah. Because maybe they worded it weird because it was them writing it. This has been like a studied, like validated tool, like research wise. You
Yeah.
can't argue that anymore. So stop.
Yeah.
I tell people like
Yeah.
stop it. It's not gonna help.
The
Just accept
interesting,
it.
yeah, the stats and everything that comes from FSBPT. I've sat in a couple of their courses just to learn more about FSBPT and the NPTE and things like that.
Oh yeah.
The stats that they use are just amazing, like how they pull this together. This is not just questions that were thrown down on a piece of paper and like handed out like candy. Like they have vetted this stuff very, very well. So you should feel confident that you are taking a well-tested exam whenever you go in there. Now, I have a question for you though, because you were talking about wellness and mental health and how we should all be taking care of ourselves. Did you have any pushback from anyone when you were like, hey, I'm going to start this business called PTA Elevation where I'm going to help people and mentor them while I'm in PT school? Was there anybody who was like, that's
Oh, there were people that
great.
like constantly were like I'm not gonna get into it too much, but somebody almost tried to like sue me to shut me down. Like there are people who are major haters, and I'm gonna call them haters, even though that sounds like middle school stuff, but they are. But fortunately for me, like I think a lot of people when they start a business, they get pushed back from their own family and stuff because again,
Yeah.
they just don't want you to be uncomfortable and doing something hard. They want to make your parents want to make your life as easy as
Yeah.
possible.
They don't want to see you struggle. Yeah.
Yeah, exactly. But my family, I'm the only healthcare person. The rest of them are business majors. My dad did finance, my mom did accounting, my brother's like finance project manager stuff. So the rest of my family doing all business stuff. So they get it. And they kind of understand to a point. They don't have their own businesses. My dad actually did just start his own business. So if you're in the Harrisburg area and want someone to drive you around in a Rolls Royce, hit up my dad. That's what he's doing for like
Note to self.
weddings and
Yeah.
stuff. But they understood that it was a lot of work. And my boyfriend was very supportive because he knew I was doing this because of basically him, like wanting to create something that I wish I could have done for him. He knew I was helping people. He knew it was, part of it. So like I had very good support. I also hired business mentors to help me out. It's the guys from Pre-PT Grind. So I hired them to help me with my business. I'm still working with them because we've had such a positive experience and it's been really helpful. So there are people who will push you back and be like, why are you doing this? Or like, be like, why are you posting this stuff? Blah, blah, blah. Like, and I've had like, people that like don't talk to me anymore. And that's okay because the majority of people that I have in my life have been very supportive and they're just like, you go, girl. And I have people who
Give
are
them a
like,
shout out. Give them,
yeah,
yeah, all those people who were in your corner. I mean, they deserve
exactly.
it.
And that's really all you need. You need a couple good people in your corner. And I think, I don't know if you follow Alex or Mosey at all.
I
Um,
follow so many people though, like,
his
you know,
stuff is great. So I would definitely look into his, but like his biggest thing is just like if I share with you an accomplishment of mine, or I tell you I'm doing something that's like, obviously not like illegal, rude, homophobic, all of those sort of things. If I'm telling you I'm starting this and I'm doing this, or like I've successfully done this, if your answer to me is not overwhelming, yes, awesome, go kill it, man, I believe in you, or like that's an amazing accomplishment, congratulations. If that's not how you feel, I don't want you in my life. And he's not saying that I only want yes people around me. He's like, the people in your life need to want to see you be successful, or they're happy with your success when good things happen to you. If anybody is saying like not good things, then it's like, okay, they're not somebody worth being around. So I just kind of like audited my circle and I'm just like, if you're not supportive, like you can be like questioning, like, why are you doing this? Why are you doing that? Like, explain to me. And then I explain to you and you're like, okay, like I get it. That makes sense. Like you have to want it so bad and
you got
do
to
so
build
much.
that network. You got to build that team of people who you surround yourself
Exactly.
with that continue to push you. I say that all the time. Of course, maybe in different other aspects, but Yeah, I mean, I'm involved with a lot of different professional organizations and a lot of different places. And when I talk about things that might have been successful for me, I don't do it just to like brag or anything like that. But for me, my perspective is I do it so that other PTAs can say, oh, I don't have to be stagnant. I can move. I can change.
Exactly.
I can do extra things. I can have a side gig. I can have a side hustle. I can help mentor other PTAs who are getting ready to take the
Yeah.
NPTE. So, I mean, you can't take it as, oh, that person's bragging. You got to take it as that person's giving you a path forward. They're giving you motivation. They're pushing you forward.
Yeah, exactly. 100%. Like, that's fine. Because the people who quote unquote would be doing bragging and just like yapping about themselves and like everything under the sun for a while. First of all, I'm yapping about myself because I'm like on an interview here. Like obviously this isn't bragging. I'm like I was literally asked to come on here and talk about
I
myself.
asked you to come on here. Yes.
Exactly. And that's why I tell people like I'm like you have to be they don't have to understand what's going on. They have to believe in you. They don't have to believe in your business. They have to believe in you. And that's the number one thing. So no matter what you want to do, and if somebody tells you, oh, you don't have enough experience, seriously, that is, oh my God, that's Katie. If I'm talking about biggest pet peeves is when someone's like, are you sure you have enough experience to do that? Well, who else is doing it out here? If nobody's going to do it, I'm going to do it. Like that's what people would say about like my business and stuff. They'd be like, oh, like, well, you've only been out of school for a year. What makes you an expert on this? I'm like, who else is out here doing this for PTAs? Like, where are the other people out here making podcasts? I don't see anybody. I'm gonna go do it. Now I have like years worth of content, and somebody could have told me, oh, don't start until you're 5 years out. 5 years out for me would have been like later this summer or something like that. Like,
Yeah.
there's people who need you now, and
Hit the
that's
start
okay.
button. Hit the start button. Again, this is a
Exactly.
theme that I
So
talk
I'm
about
like, you
all
can
the
do
time
whatever you
on
want.
the.
You can own a clinic if you really want to. You just gotta hire a PT to do evals. Like you
Mhm.
can do whatever you set your mind to. 100%. You just need, you need drive and you need a person in your corner. And I think Alex also put out this thing where he was just like, just put out so much like material that and like have so much output that you can't like even yourself can't deny that this is working and that you're making a difference because that's the number one thing. And that's what I tell myself when I go out and I do PT elevation stuff. Obviously, I'm making money from this and I'm making a good living and I'm very content with the money that I'm making from this. I'm not gonna lie, I'm doing great. I'm happy with it. But my number one most important thing is that I'm making an impact on students. That's why I always lead with here's all the students I've helped. Here's all the people who have careers, have lives. There are babies that have been born because I finally helped someone pass the boards and they can actually go have their
Oh.
family. And that's why I do this because at the end of the day, like somebody says, like, the richest place in the world is a graveyard. Like I'm going to die eventually. The biggest thing that I need to make sure I'm doing is making the impact on people. And that's the most important thing. So that's what my business mentors teach me. It's like it's all about the impact you're making. If you make more impact, obviously you're going to have more income, but that's the most important thing. So just reminding yourself of that. You can do whatever you want. Make sure you're doing it for the right reasons, whether it be PT school, starting a business, becoming a clinic manager, doing whatever you want to do. That's what I'll leave people with. Just make sure you're doing everything for the right reasons. You'll meet the right people. Things will line up. But the ultimate thing is that you're showing up, doing things every day because it's going to be hard being stuck in the situation that you're stuck in. And it's also hard starting a business or starting a new journey or doing something new. That's my
It's
biggest
always
thing.
gonna be
So
hard.
it's always
Anything
going to be
worth
hard.
it is gonna have a little bit of a fight that goes with it. This was wonderful information. Thank you so much.
Yeah, of
Before we
course.
go though, where can people find more information about PTA Elevation?
Yeah, so my website is ptaelevation.com. So if you just type that in, it should pop up. Um, Instagram's a great place because I'm on there. I'm lurking there all the time. So my Instagram page is just PTA Elevation, all one word. There is a backup one that's like pta.elevation, but you'll see that there's like no post. That's my backup account because one time my entire account got shut down on like Halloween. I thought it was a cruel joke, but it
Oops.
happened to like two-thirds, like a third of like Instagram posts people. So yeah, that was fun. So it's the one that has like almost 2,000 posts. That's me. You can
Okay.
message me there. I'm the only one. I'm a one woman show over here. Actually, I think people don't realize that it is me. I'm hanging out over here.
That's a
There's a
lot.
lot. There's a lot. I mean, just leverage AI. Like people are just like, oh my gosh, AI is working. Nah, ChatGPT is my bestie. Like leverage things that you can because that's how I'm able to do this and impact as many people. So
Mhm.
like I'm over there. Message me. I'm happy to help. I'll reply to your message and stuff like that. But yeah, I have my YouTube channel, so just PTA Elevation on there on YouTube. I think there's like 4,000 subscribers. And then I have my podcast. So again, if you just type in PTA Elevation, it should pop up. But that's where you can find me. I'm on TikTok too. So I'm everywhere.
Wow. Well, there are a plethora of different ways that people can get a hold of you, find your content, purchase your study tools that are out there. So again, thank you, Brianna, for coming on today. It was wonderful. I think that everybody's going to really benefit from the information that you gave today and the motivation that you gave today. So we appreciate your time.
Of course. Thank you.
Yes, thanks.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision-making should be made from its content. See you next time.